NREMT question breakdown. Emergency medical technician review, 25 tricky questions. Question 1. A 65-year-old male with a history of COPD is breathing through pursed lips. What is the physiological purpose of this action? To increase the rate of oxygen diffusion, to provide back pressure to the alveoli, to decrease the work of the diaphragm, to stimulate the hypoxic drive. Pursed lip breathing provides back pressure to the alveoli, preventing them from collapsing during exhalation and allowing for better gas exchange. Question 2. Which of the following is the most significant advantage of the two-person method of providing bag valve mask, BVM, ventilations? It allows for higher oxygen concentrations. It reduces rescuer fatigue. It ensures a better mask-to-face seal. It prevents gastric distension. One rescuer can use both hands to maintain a tight seal while the other squeezes the bag, ensuring more effective ventilation than a single rescuer seal. Question 3. A patient is found pulseless and apneic 7 minutes after collapsing. What is the priority intervention? Check for a carotid pulse. Immediate high-quality chest compressions. Apply and analyze with an AED. Deliver 2 rescue breaths. Current guidelines emphasize starting chest compressions immediately in witnessed or recently occurred arrests to maintain perfusion. Question 4. A patient with suspected spinal trauma requires airway management. Which maneuver should be used? Head tilt, chin lift, modified jaw thrust, hyperextension of the neck, lateral recovery position. The modified jaw thrust opens the airway while minimizing movement of the cervical spine. Question 5. A patient reports intense pain between the shoulder blades that radiates to the lower back. Which condition is most likely? Myocardial infarction, acute cholecystitis, abdominal aortic aneurysm, AAA, pneumothorax. Pain radiating to the back or between the shoulder blades is a classic sign of a dissecting or enlarging abdominal aortic aneurysm. Question 6. Hyperventilation in a patient results in which of the following physiological changes? Increase in blood CO2 levels, decrease in blood pH, decrease in blood CO2 levels, increase in blood oxygen saturation only. Hyperventilation blows off excess carbon dioxide, leading to hypocapnia and respiratory alkalosis. Question 7. A 75-year-old patient presents with black, tarry stools and coffee ground emesis. What is the most likely diagnosis? Lower GI bleed, upper GI bleed, bowel obstruction, gastroenteritis. Tarry stools, melena, and coffee ground emesis are indicative of digested blood from an upper gastrointestinal source. Question 8. Which of the following is considered a late sign of shock in a pediatric patient? Tachycardia, tachypnea, hypotension, capillary refill of 3 seconds. Children compensate well for shock. By the time their blood pressure drops, hypotension, they are in decompensated shock. Question 9. During the primary assessment, you find a large open wound to the chest. What is your immediate action? Apply a sterile dressing. Cover the wound with an occlusive dressing. Start high-flow oxygen. Perform a rapid trauma survey. An open chest wound, sucking chest wound, must be sealed immediately with an occlusive dressing to prevent tension pneumothorax. Question 10. An 18-year-old female is experiencing an anaphylactic reaction. She has hives and wheezing but a stable blood pressure. What is the first-line medication? Diphenhydramine, albuterol, epinephrine, methylprednisolone. Epinephrine is the drug of choice for anaphylaxis as it reverses bronchoconstriction and vasodilation. Question 11. What is the correct depth of chest compressions for an adult during CPR? 1 to 1.5 inches, at least 2 inches, 3 inches, half the depth of the chest. Current AHA guidelines recommend a compression depth of at least 2 inches, 5 centimeters, but no more than 2.4 inches, 6 centimeters. Question 12. A patient is complaining of a tearing sensation in their chest. This is a common description for which emergency? Heart attack, aortic dissection, pulmonary embolism, angina pectoris. A tearing or ripping sensation is highly characteristic of an aortic dissection. Question 13. Which heart rhythm is the AED designed to shock? Asystole, pulseless electrical activity, P. Ventricular fibrillation, VFib, sinus bradycardia. The AED identifies and shocks shockable rhythms like VFib and pulseless VTach. Question 14. A patient has a pulse of 120, BP of 80/40ths, and cool, clammy skin. Which stage of shock is this? Compensated, decompensated, irreversible, psychogenic. The presence of hypotension, low BP, indicates the body's compensatory mechanisms are failing. Question 15. In what position should a pregnant patient in her third trimester be transported to prevent supine hypotensive syndrome? Prone, supine, left lateral recumbent, Trendelenburg. The left lateral position removes the weight of the uterus from the inferior vena cava, maintaining venous return. Question 16. What is the rule of nines percentage for an adult with burns to the entire front and back of both legs? 18%, 27%, 36%, 45%. Each leg is 18%, 9% front, 9% back. Both legs front and back equals 36%. Question 17. A patient has been submerged in cold water for 15 minutes. How should you approach resuscitation? Declare death immediately. Perform CPR and attempt warming. Warm the patient fully before starting CPR. Ventilate only. Hypothermic patients are not dead until warm and dead. Aggressive resuscitation should be pursued. Question 18. What is the primary goal of the Platinum 10 minutes in trauma care? To complete the surgery within 10 minutes. To spend no more than 10 minutes on scene. To reach the hospital in 10 minutes. To perform a 10-minute assessment. Trauma patients benefit from rapid transport to definitive care. Scene time should be minimized to 10 minutes or less. Question 19. Which part of the brain controls basic functions like breathing and heart rate? Cerebrum, cerebellum, brainstem, hypothalamus. The brainstem, including the medulla oblongata, regulates involuntary vital functions. Question 20. When assessing a patient with a behavioral emergency, what is your first priority? Gather a medical history, restrain the patient, ensure scene safety, establish a rapport. Safety for the EMS crew and the patient is the absolute first priority in behavioral calls.